Hi everybody. So I decided to do my presentation this week on the medication Bupropion because I'm sure everybody has come across this medication in practice and given it out at the hospital probably hundreds of times. But it's one of those medications that I often forget about, so I thought it'd be a good reminder for me to brush up on what exactly this medication is. So this medication is an antidepressant. It is a norepinephrine and dopamine reuptake inhibitor, and it's also a smoking deterrent, so it is utilized in smoking cessation. So how exactly does bupropion work? So bupropion works by inhibiting the reuptake of norepinephrine by blocking the norepinephrine reuptake pump. It also inhibits the reuptake of dopamine by blocking the dopamine reuptake pump. By blocking both the reuptake of norepinephrine and dopamine, this allows for increased neurotransmission of dopamine and norepinephrine. Now, what exactly are the effects of increased neurotransmission of dopamine and norepinephrine? Those effects are diminished depression, and it can decrease cigarette cravings. So what are some potential side effects due to the mechanism of action I just described? Some patients have experienced insomnia or agitation, dizziness, and or tremor may occur due to norepinephrine and dopamine action in areas of the brain. Patients have also experienced dry mouth, nausea, sweating, constipation, and anorexia due to the parasympathetic and sympathetic involvement and effects of this medication. So who exactly is this medication contraindicated in? So this medication should not be prescribed to people who are taking MAO inhibitors, linezolid, or methylene blue concurrently. It also should not be used in patients who are taking ritonavir, concurrently. Patients with seizure disorders, any CNS tumors, arteriovenous malformations, anorexia nervosa, and or bulimia should also not take this medication, and it should not be utilized if patients are withdrawing from any alcohol, benzodiazepines, barbiturates, or anti-epileptic drugs. This is due to the increased seizure risks if the patients are taking this medication and then withdrawing from those substances. So what exactly are the indications for use of this medication? So in the United States, bupropion is currently utilized for major depressive disorder, seasonal affective disorder, and smoking cessation. Bupropion in major depressive disorder will be more of a long-term therapy, while in seasonal affective disorder, the patient may begin taking it in autumn time, late fall, and they'll take it through the winter, and then once spring comes around, they'll start tapering off the medication. And as always, I included education because I think it's important. So patients should be, who are prescribed bupropion, should be educated to take the dose as directed. Also, that medication may take up to 4 weeks to have the desired effect. And I know this can be discouraging, so I think it's a good reminder for patients that if you don't have immediate symptom relief, that is normal, and then it can take up to 4 weeks, and not to get their hopes up that this medication is gonna instantly cure them when it takes time. Patients should also be educated to assess for suicidality and notify healthcare provider immediately if any suicidal ideation occurs. That way it can be addressed. And patients should also be educated to assess for any agitation, restlessness, any panic attacks, insomnia, irritability, aggressiveness, mania, or any other changes in their behavior. If those happen, they should contact their healthcare provider as soon as possible. And these are my references. Thank you guys for listening to my presentation. I look forward to listening to yours. So I hope you guys all have a great week.